any employee who has worked here for 15 or 20 plus years about why they've stayed so long, and you're likely to hear it's because our mission to serve is so compelling. Our story begins in 1917 with the opening of the Robert B. Greene Memorial Hospital on Leona Street. Named for the county judge and state senator, a crusader for social causes, who died tragically at the age of 42.
Up your duffels in your own. Sit back and smile, smile, smile. While you
San Antonio was booming, the largest city in Texas at the time, and still growing with thousands of troops at the start of World War I and refugees fleeing the Mexican Revolution. Bexar County suffered high rates of tuberculosis and other infectious diseases. San Antonio sorely needed a new charity hospital. The city and county each contributed the funds to build it. When the influenza epidemic of 1918 hit the city hard, the Robert B. Greene Memorial Hospital was fully operational, restoring lives and giving hope to those who came seeking care. From the start, the Greene was more than just a hospital, providing a training ground for doctors and nurses. The hospital became known for its expertise in specialty surgeries, attracting doctors from across the country to train here. The nursing school graduated its first class in 1919 and continued training until it closed many decades later.
I had a friend I thought was true, but I done found out friends never do.
With the nation in the grips of the Great Depression and the medical needs of the community so great, the Greene struggled. It lacked the funds to keep up its facilities and equipment. In 1947, the Robert B. Greene closed its doors, leaving open only a small and desperately needed polio ward funded by a private charity. But the need remained. A statewide shortage of doctors led to new interest in a place to train them. The community decided the Greene was too important to stay closed, and it reopened the next year. Voters overwhelmingly approved the Bexar County Hospital District in 1955, making it one of the first hospital districts in Texas and stabilizing the Greene's finances through property taxes. Today, however, only about 23% of our funding comes from property taxes. Meanwhile, local leaders fought to bring a medical school to San Antonio. State lawmakers finally approved the new medical school, now the University of Texas Health Science Center, on the condition that a teaching hospital be built within a mile of it. In 1968, the Bexar County Hospital, now University Hospital, and the medical school opened their doors. The state-of-the-art hospital and the expertise of the UT faculty offered the highest level of care available. Most important of all, excellent health care would be available to rich and poor alike. With the new hospital in place, our hospital district leaders shifted their focus to the community's needs, specifically how to keep people healthy and out of the hospital. After a $1 million gift from local philanthropist Lady Brady, the downtown hospital became the Brady Greene Community Health Center to provide outpatient care. In the 1990s, the hospital district began opening clinics throughout the county, improving access to care for families. And when the West Side's only hospital, Lutheran General, closed its doors, the hospital district bought it and created the Texas Diabetes Institute, a nationally recognized center of excellence. Our commitment to improve access, quality, and convenience continues today. Our network of clinics now includes more than 20 locations and 2 Healthy U Express mobile units for mammography and primary care services. One of our key values is to develop new and better treatments through research. Researchers right here have made advancements and medical breakthroughs in organ transplantation, trauma surgery, neonatology, cardiology, diabetes care, and much more. University Hospital performed the first bone marrow transplant in South Texas and the first heart transplant in the region 2 years later. We were among the earliest in the world to use stents to treat coronary artery disease, a technology invented next door at UT Health Science Center. Today, there are more than 500 research studies underway at University Health System facilities at any time. When Bexar County Hospital first opened its doors, we had 150 doctors and a staff of 1,200. Today, we have 800 physicians and more than 6,000 staff members, making us one of the largest employers in the county. In 2010, the University Health System was the first in South Texas to earn magnet designation by the American Nurses Credentialing Center. U.S. News & World Report has repeatedly ranked us the best hospital in San Antonio and in the top 10 in Texas. We have been among the most wired health systems in the nation for technology since 2010 and among the top organizations of any kind for staff learning and development. In 2013, our historic Robert B. Greene campus was transformed by a new 6-story clinical building and restoration of the original hospital building. In 2014, the million-square-foot Sky Tower doubled the size of University Hospital. As we look ahead to our next century of service, we are committed to advancing the legacy of Robert B. Greene and the community leaders of long ago, who saw the need and stepped up to assure that high-quality healthcare is available to everyone. Our leaders today share the same passion and commitment, actively imparting the mission to the next generation of healthcare professionals. We are never at rest as we seek out new and better ways to enhance the experience and healing of our patients. We welcome you as a member of the University Health System team.